go. Yes, you are ready. Yes, you are.
So oftentimes it's recommended to latch on a baby who latches on more easily first. And then that way, once the nice fish lips are there, and I like to call it, they're kind of like guppies on there. They're not going to let go.
She's all good.
Yep. And then you can come over to the baby that might be having a little bit of a challenge, so you can use both hands. Now, Shannon's babies are 6 weeks old, Shannon?
6 weeks on Monday.
6
yes.
weeks on Monday. Okay. So these babies have had a lot of practice breastfeeding and latching on. For the babies that are still even younger and having a little bit of a challenge, when you latch one on, sometimes it can be helpful to take a rolled up blanket and put it behind the baby's head and behind their little shoulder blades. And so that way, when one baby's on, using this as a kind of a pillow or a rest, and that way then going over and bringing the other baby on. So the first baby that's on isn't rolling off backwards. Shannon has a really great position as well because she's using this pillow below to help lift them up, that the babies actually are coming into her very nicely as well. So they've got their legs almost tucked around the back, and they're coming face forward, almost like sliding into the breast. And so really the main thing is keeping them so that they're not rolling backwards, but rather into the breast. So how does that feel, Shannon?
Comfortable?
What do you find makes this the most comfortable?
I just make sure that their bodies are kind of turned to the side so that, like you said, they're not kind of rolling off the pillow. Because I do have bigger boobs, they can tend to be on their back, so I just try to remember to push them up so that they're more on the side and that they're staying on.
And the one thing that's going on right now, which is super common, is one latches on, you have them both on then, and then one decides to fall off. So it's being flexible, knowing that just because they've both gotten on doesn't mean